8 urgent warning signs in your body that mean you should head to the ER immediately. Your body doesn't stay silent when something serious is going on. In fact, it often sends clear messages, signals that, if noticed in time, can mean the difference between recovery and irreversible damage. Today, we're diving into 8 physical warning signs that should never be ignored. Not tomorrow, not after a nap. Immediately. These are not vague or random symptoms. These are the red flags that doctors and emergency professionals say demand urgent attention. No delay, no second guessing. This video isn't here to frighten you. It's here to empower you. Because too many older adults downplay the early signs, thinking it's just aging, or probably nothing. Some even hesitate to speak up because they don't want to inconvenience anyone. But when it comes to your health, hesitation can turn a minor issue into a life-threatening emergency. Being informed means being prepared, and being prepared gives you control. In this video, you'll discover the 8 most critical signs your body might be in danger. Signs that experts agree could save your life, or the life of someone close to you, if recognized in time. So stay with us, because what you're about to learn could be one of the most important things you hear all year. Let's begin with sign number 1. Chapter 1. Sudden or worsening abdominal pain. The ache you ignored tonight could become the ambulance ride you never expected. It usually starts quietly, a little discomfort in your stomach. Maybe you just finished dinner. It's probably something you ate, right? You reach for an antacid, sip some water, and wait. But instead of fading, the pain grows, it shifts, it tightens, and that inner voice whispers, "This feels different." Now here's the truth that too many people, especially older adults, learn too late. Abdominal pain in seniors can be deceptively silent and dangerously serious. Doctors at the American College of Emergency Physicians have long warned that older adults often don't show textbook symptoms when it comes to internal emergencies. No fever, no vomiting, just an ache. And that ache could mean something far more alarming. Appendicitis, intestinal blockage, a bleeding ulcer, pancreatitis, or even internal bleeding. The longer you wait, the more dangerous it becomes. If you're over 60 and you feel pain in your belly that doesn't feel normal, treat it like a red alert, not a background noise. Let me tell you a story that brings this to life. Frank, a 73-year-old Army veteran from Columbus, Ohio, was as tough as they come. That Sunday evening, he felt a dull pressure near his lower left abdomen. He thought it was just indigestion. Nothing a little Pepto won't fix, he told his wife. But a few hours later, the pain had intensified. He couldn't sleep. He couldn't eat. He couldn't explain it. He just knew something was off. The next morning, he was rushed to the hospital. The diagnosis? A twisted section of his intestine, a volvulus. It was cutting off blood supply and killing tissue inside him. If Frank had waited just a few more hours, he might have needed emergency removal of part of his colon. Or worse, he might not have made it at all. Frank later admitted, "I didn't want to cause a fuss, but now I know waiting was the real danger." This story isn't rare. Emergency rooms across America see it every day. Seniors arriving late, still clutching their sides, still hoping it'll pass, while the damage inside has already taken hold. So how do you know when it's time to go? You don't need to be a doctor. You just need to listen to your body and respect what it's trying to tell you. If the pain is sudden, sharp, or new, if it's getting worse, not better, if you feel dizzy, sweaty, bloated, or unusually tired, you don't wait. You don't Google. You don't downplay. You go. Better to find out it was gas than to find out too late it was internal bleeding. As one ER nurse put it, at the Cleveland Clinic, Dr. Shell. Rebecca Mullen reminds her older patients, stomach pain after 60 is never just a stomach ache. It's a message, and sometimes it's your only warning. And what about you? Have you ever felt pain in your gut that just didn't feel right, but convinced yourself to write it out? Leave a comment and share your experience. Someone else might learn from your story before it's too late. If you found this information eye-opening, tap that like button. If someone you care about tends to tough things out, share this video with them. And if you want real, reliable guidance to stay healthy and independent for decades to come, subscribe to Golden Wise Elders, because aging well isn't just about adding years to life, it's about adding life to your years, and that starts with listening to your body. Abdominal pain is a loud signal, but sometimes the most dangerous warnings don't come with pain at all. Sometimes they arrive as silence, as air slipping away from your lungs while you're doing absolutely nothing. That brings us to another critical sign that far too many people ignore: shortness of breath. Even at rest, sign number 2, shortness of breath while resting. If catching your breath feels like a workout while doing nothing at all, Don't wait. Your body is warning you. There's something deeply unsettling about feeling out of breath when you haven't done a thing. No stairs, no walk, no exertion, just sitting still. And suddenly, every breath feels like pulling air through a straw. That's what happened to Barbara, 68, a retired librarian in Colorado. It was an ordinary Tuesday evening. She was curled up in her recliner, watching her favorite mystery show, when she noticed her chest felt tight. Not painful, just heavy, as if someone had set a sandbag on her rib cage. She paused, took a breath, and felt no relief. Within the hour, she had to lean forward just to breathe. Like many people, Barbara waited. I didn't want to be dramatic, she said. I figured I'd rest, and it would pass. But by midnight, she was struggling to speak between breaths. Her son rushed her to the ER. Doctors found fluid had filled the space around her lungs, compressing them, what's known as pleural effusion. Worse yet, it was caused by congestive heart failure, a condition she didn't even know she had. If she had waited until morning, she might not have woken up. But what does shortness of breath really mean when it comes out of nowhere? For adults over 60, breathlessness while resting isn't a sign of being out of shape. It's often the body's earliest and most urgent signal that something deeper is wrong. Medical experts from Mayo Clinic and Johns Hopkins warn that shortness of breath while inactive may indicate one of several life-threatening conditions. Congestive heart failure, CHF. When the heart can't pump blood effectively, fluid backs up in the lungs. Pulmonary embolism, a blood clot travels to the lungs, blocking circulation and starving tissue of oxygen. Pneumonia or bronchitis. Even a mild infection can become dangerous in older adults, especially if undiagnosed pleural effusion. Fluid fills the chest cavity, restricting lung expansion. Arrhythmia or valve disease. The heart may beat too fast, too slow, or unevenly, causing oxygen loss, COPD, or asthma flare-ups. Chronic respiratory illnesses may suddenly worsen, even in people with no history of smoking. What does it feel like when it's serious? Not every dangerous condition causes gasping or dramatic collapse. The symptoms are often quiet but persistent, such as feeling winded while sitting, watching TV, or reading, needing to sleep propped up on pillows, feeling like you can't get a full breath even at rest, slight pressure or heaviness in the chest without pain, fatigue with no reason, irregular heartbeat, or mild dizziness after standing. And the real danger? These symptoms are easy to ignore until they become impossible to ignore. Breathlessness without movement is like smoke without fire. You can't see the flames yet, but something's already burning beneath. The risk of ignoring it. Dr. Naomi Patel, a cardiologist at NYU Langone Health, explains, "We've seen patients who went to bed breathless and didn't wake up. It happens quietly, but it doesn't happen without warning." When left untreated, conditions like CHF or pulmonary embolism can lead to cardiac arrest, permanent lung damage, sudden stroke or collapse, organ failure due to low oxygen levels. These are not slow-moving problems. In many cases, the difference between life and death is how soon you get help. What to do? Even if you're not sure if you, or someone you know, starts feeling short of breath without doing anything strenuous, don't wait to see how it feels in the morning. Don't assume it's anxiety, weather, or aging. Don't lie flat if breathing worsens. It may increase fluid pressure. Call 911 or go to the nearest ER immediately. At the hospital, doctors can run tests to check heart rhythm, oxygen levels, blood clots, and signs of infection, often within minutes. Fast action means faster recovery. You are not being dramatic. You are being smart. Barbara said it best. "I almost stayed quiet. I'm glad my son didn't let me. If I had waited until morning, I might not be here." So let me ask you this. Have you ever felt short of breath without any reason, or know someone who did and brushed it off? Tell us in the comments. Your story might help someone realize it's okay to speak up before it's too late. If you found this information helpful or eye-opening, please give this video a like. It helps others find content that could truly save lives. And if you know someone who always says, "I'm fine," even when they're clearly not, share this with them. Let them know they don't have to guess what's serious and what's not. When the body struggles to breathe, the heart and lungs aren't the only organs under threat. The brain feels it too, often before we even realize. And sometimes the earliest sign that something is wrong isn't physical at all. It's mental. Let's talk about sudden confusion or disorientation and why it could be your brain's first cry for help. Sign number 3, sudden confusion or disorientation. When someone suddenly forgets who they are, where they are, or why they're there, it's not just getting old. It could be life-threatening. It's a moment that sneaks up quietly and terrifies everyone in the room. a father who forgets his daughter's name, a neighbor who wanders into the street, confused about which house is his, a wife who looks at her husband of 40 years and says, "Who are you again?" These moments don't just break your heart, they should set off sirens. Because in older adults, sudden confusion is rarely just forgetfulness. It's often the first visible sign that something has gone very, very wrong inside the body. If the mind changes overnight, don't call it aging. Call it what it is, a medical emergency. Take Eleanor, 79, a retired piano teacher from Minnesota. Sharp, independent, proud. She ran her errands like clockwork and baked every Sunday. One afternoon, she walked to the grocery store, but then stood in aisle 4, staring at a can of soup, not knowing how she got there or why. A concerned shopper noticed her confusion and called her daughter. When Eleanor was brought to the hospital, the doctors ran tests and discovered something most people would never expect. She had a urinary tract infection. That's right, a simple UTI. But in seniors, UTIs often don't cause pain or burning. Instead, they go straight to the brain, triggering delirium, a sudden state of mental fog that can look a lot like dementia or even stroke. Why confusion isn't just getting older. According to Harvard Health, sudden confusion is one of the most common and most dangerous symptoms in people over 65. But it's also one of the most overlooked. Why? Because it doesn't come with blood, bruises, or broken bones. It's subtle. It creeps in, but it signals serious trouble. Common medical causes of sudden confusion in older adults include urinary tract infections, especially in women, pneumonia or other infections, even without a cough or the fever stroke, or TIA, mini stroke, cutting off oxygen to the brain, low blood sugar or electrolyte imbalance, common with missed meals or medication issues, medication side effects or interactions, especially with new prescriptions, dehydration, something as simple as not drinking enough water, sepsis, a full body, reaction to infection, which can lead to organ failure. What does it look like? What should you watch for? The signs aren't always dramatic, but they're always urgent. Repeating questions or forgetting familiar names, trouble following a simple conversation, getting lost in a well-known neighborhood, sudden irritability, paranoia, or aggression, sleepiness or unusually slow responses, saying things that don't make sense. Even if the confusion seems temporary, even if the person snaps out of it, an hour later, don't ignore it. In seniors, the brain is often the first organ to speak up when something's wrong with the rest of the body. What to do, and why time matters. If someone you know suddenly seems confused or not like themselves, don't wait and see. Don't assume it's just tiredness or old age. Don't try to explain it away with stress or medication unless a doctor says so. Take them to the nearest ER or urgent care immediately. Let doctors run basic tests, urine sample, blood sugar, CT scan if needed. Keep a record of recent meds, behavior changes, or illnesses. Dr. Samantha Lee, a geriatric neurologist at Stanford, says, "The earlier we identify the cause of confusion, the better the outcome. Many of these patients return to normal if treated within hours, but if we miss the window, the brain may not fully recover." You know them better than anyone. Trust your gut. Eleanor's daughter said it best. "I knew something was wrong the moment I saw her eyes. She looked lost in her own mind, and that wasn't my mom." So what about you? Have you ever seen someone suddenly act out of character, forgetting names, getting lost, or speaking strangely? Leave a comment. Your story might give someone after 50, health isn't just about the heart, the bones, or the lungs. It's about the mind, and protecting it begins with awareness. While confusion signals that the brain may be under distress, there's another vital organ that often speaks in more subtle yet deadly ways, the heart. And the message it sends doesn't always come as sharp pain. Sometimes it's just pressure, a heaviness you can't explain. Let's take a closer look at why chest discomfort that won't go away could be the heart's way of pleading for urgent attention. Sign number 4, chest pressure or discomfort that won't go away. When your heart speaks in whispers, don't wait for it to scream. It doesn't always start with a dramatic collapse. Sometimes it begins with a strange tightness, like a belt drawn too snug around your chest. You feel it while reading the newspaper, folding laundry, or sitting quietly after lunch. No pain, just a presence. And you wonder, is it heartburn? Maybe anxiety? Should I lie down and see if it passes? That's the crossroads moment, the one that determines how the rest of your life plays out. Heart attacks don't always look like they do in the movies, especially not after age 60. That's why this next story hits so close to home. Harold, A 71-year-old retired mail carrier in New Jersey was always the strong, silent type. That Tuesday afternoon, he felt what he described as a pressure in his chest. Not sharp, not severe, just strange. He figured it was gas. He drank water, paced a little, and even took an antacid. But the feeling lingered. Then came the exhaustion. He hadn't done anything, yet his arms felt heavy, his legs shaky. His wife noticed he looked pale and asked if he was okay. Just tired, he muttered, but she insisted they go to urgent care. Just in case. That decision saved his life. At the hospital, Harold was diagnosed with a non-ST elevation myocardial infarction, a type of heart attack without the classic crushing pain. The cardiologist later told him, if you had waited another hour, this could have turned into a full-blown cardiac arrest. What makes chest discomfort so dangerous in older adults? Because it doesn't always hurt. It doesn't always drop you to the floor. It doesn't always feel like an elephant sitting on your chest. Sometimes it's a mild squeezing, dull aching behind the breastbone, fluttering or pressure radiating to your jaw, neck, shoulder, or arm, sudden fatigue, lightheadedness, nausea, or sweating. According to the American Heart Association, over 1/3 of heart attacks in adults over 65 present with atypical symptoms. This is especially true in women and people with diabetes or high blood pressure. If the pain is vague, but your instinct says it's not right, listen to that instinct. It's often more accurate than you think. What might be happening inside your chest? Sudden or lingering chest discomfort could be a sign of coronary artery blockage, limiting oxygen flow to your heart muscle. Silent heart attack, common in seniors, often missed until it's too late. Aortic dissection, a rare but fatal tear in the main artery. Pericarditis, inflammation around the heart, often with flu-like symptoms. Angina, a warning sign of heart disease triggered by minimal exertion or stress. What to do? Without delay. If you're sitting still and feel unfamiliar chest tightness, pressure, fluttering, or fatigue, don't lie down. Don't wait to see if it passes. Don't assume it's just stress or indigestion. Call 911 immediately. Time is muscle. Every minute your heart doesn't get enough oxygen, tissue dies, and the damage may be irreversible. Dr. Carla Voss, a cardiologist at Johns Hopkins, reminds us, when the heart whispers with subtle symptoms, it's testing you. The ones who survive are the ones who act, even when it doesn't feel dramatic. Your life doesn't deserve a coin toss. Harold's wife didn't hesitate, and that saved him. So I ask you, have you ever experienced a strange feeling in your chest and talked yourself out of getting help? Tell us in the comments. Let's turn hindsight into wisdom for someone else's tomorrow. If this segment gave you clarity, tap like. It helps the YouTube algorithm share this with people who need it most. And if someone in your life always says it's nothing, even when they feel off, share this with them today. One quiet warning might be all they get. And remember to subscribe to Golden Wise Elders for more real stories, real science, and real conversations about staying strong and smart after 50. Because sometimes, the quietest signals from your body are the ones that matter most. Chest discomfort may warn us of a struggling heart, but sometimes danger reveals itself in a much messier, more alarming way, through the stomach. When vomiting becomes relentless or when blood appears unexpectedly, it's no longer just about digestion, it's about survival. Let's talk about why persistent vomiting or vomiting blood is a red flag that demands immediate action. 5. Persistent vomiting or vomiting blood. When your stomach speaks with force, listen with urgency. We all throw up now and then, maybe from a stomach bug, maybe something didn't sit right. It's uncomfortable, unpleasant, and usually harmless. But here's the line you must never cross. When vomiting doesn't stop, or when blood appears, this is no longer a digestive issue. It's a red alert. Blood in your vomit, even just a few specks, might be your body's only chance to say, get help, now. Let's talk about Ruth, a 75-year-old grandmother from Oregon. She loved cooking for her grandkids every weekend. One Friday evening, after enjoying a shrimp dinner, she began vomiting. At first, she thought it was food poisoning, no big deal. But the vomiting kept going. For hours, she noticed tiny dark flecks in the sink. Old food? She wondered. She rinsed it and went back to bed. The next morning, she passed out in the hallway. In the ER, doctors found a bleeding stomach ulcer. It had eroded the lining of her stomach over time, likely worsened by years of over-the-counter pain relievers for arthritis. She had lost a significant amount of blood and needed immediate transfusions. The dark flecks, they weren't food. They were digested blood, a warning sign she didn't recognize. Why vomiting becomes dangerous. Fast vomiting, in and of itself, isn't always alarming. But in people over 60, the body has less ability to recover quickly from fluid loss, bleeding, or internal stress. That makes persistent vomiting, or vomiting with blood, an entirely different beast. According to the Cleveland Clinic, the most serious causes include gastrointestinal bleeding from ulcers, tears in the esophagus, or ruptured blood vessels, gastric or esophageal cancer. Bleeding can be a first hidden symptom, torn esophagus, Mallory-Weiss tear. From repeated vomiting, liver disease complications, causing swollen veins in the digestive tract, drug reactions, especially with NSAIDs, blood thinners, or steroids. Even one episode of vomiting blood, no matter how little, should be treated as a medical emergency. If you wouldn't ignore bleeding from your arm, don't ignore it from your stomach. What should you watch for? The signs aren't always obvious, so here's what to pay close attention to. Vomiting more than 2-3 times in 24 hours. Seeing red or dark coffee ground material in vomit. Feeling dizzy, faint, or cold after vomiting. Swelling or tenderness in the abdomen. History of ulcers, liver issues, or daily painkiller use. Dr. Michael Cates, a gastroenterologist at the University of Washington, explains, seniors often have silent ulcers, no burning pain, no acid reflux until bleeding begins. By then, we're already in a crisis. When to act, and how if you or someone you love is vomiting persistently or sees any blood in their vomit. Don't assume it's food poisoning. Don't take anti-nausea meds at home. Don't wait for a primary care appointment. Go straight to the emergency room. They'll check your blood count, perform scans or an endoscopy if needed, and stop internal bleeding before it turns fatal. And just like Ruth, many patients say they felt a little off until their body forced them to listen. Your body isn't overreacting. It's fighting to survive. Ruth recovered, but she spent 4 days in the hospital and had to completely change her medication routine. Her advice now? Don't tell yourself it's nothing just because it doesn't look like a horror movie. I almost weighted myself into a casket. And so I ask you, have you ever had a stomach issue that turned out to be more serious than you thought? Or maybe someone close to you did and you didn't realize how urgent it was? Share your story in the comments. That story might save someone's life. When the digestive system erupts with warning signs, we often take notice. But what if the threat isn't in your stomach, but surrounding your brain? The next symptom is quieter, but just as urgent. A high fever, a stiff neck, and sensitivity to light. In older adults, these may be the earliest and only clues of a dangerous brain infection. 6. High fever with a stiff neck and light sensitivity. When your head screams in silence, your brain could be in danger. A fever on its own often feels manageable. We take a pain reliever, drink fluids, and try to sleep it off. But when that fever comes with a stiff neck, so stiff you can't look down or turn your head, and even dim lights feel like a spotlight in your eyes, you're no longer dealing with something ordinary. Mini hook. If you have a high fever and can't bend your neck, it's not the flu. It could be something far more urgent. This was exactly the case for George, 76, a crossword-loving grandfather from Pennsylvania. That morning, he sat in his favorite chair, pen in hand, coffee beside him, but he couldn't concentrate. His head was pounding. He couldn't bend forward without sharp pain at the base of his skull. When he tried to look at the kitchen window, the sunlight made his eyes water and his stomach turn. He told himself it was just a bad migraine. But by noon, he was too dizzy to stand. His neighbor, thankfully a retired nurse, took one look at him and drove him straight to the ER. George was diagnosed with bacterial meningitis, a fast-moving, life-threatening inflammation of the protective membranes around the brain and spinal cord. He was admitted immediately, put on IV antibiotics, and doctors said another few hours could have cost him his life. Why these symptoms are so dangerous, especially after 60. In younger people, meningitis often comes with an obvious rash, cold symptoms, or a sudden collapse. But in older adults, the warning signs are quieter, yet just as deadly. According to the Centers for Disease Control and Prevention, CDC, seniors with meningitis often don't develop rashes or stiff necks right away. Instead, they may first show a dull, persistent headache, mental confusion or slowed response, nausea or light sensitivity, lethargy or inability to stay awake, a general feeling of being unwell that escalates quickly. Infections in the brain move fast. The only thing faster should be your response. Bacterial meningitis can begin like the flu, but progresses rapidly, leading to seizures, loss of consciousness, permanent brain damage, death within 24 to 48 hours if untreated. Even if the patient survives, delayed treatment can lead to long-term complications like hearing loss, memory problems, and mobility issues. How to know when it's more than just a fever? Here are red flags to never ignore, especially in someone over 60. Fever above 138.3-, inability to bend the neck forward, headaches that worsen in light or noise, sudden confusion or unusual behavior, sensitivity to sound or eye pain, nausea with no GI symptoms. Dr. Karen Hill, an infectious disease specialist from Boston Medical Center, explains, any older adult with fever plus confusion or neck stiffness should go straight to the ER. Don't wait for it to pass. It rarely does. What to do? Immediately don't stay in bed and hope it improves overnight. Don't assume it's just exhaustion or dehydration. Don't take Tylenol and wait. Go to the emergency room without delay. Doctors will run a spinal tap, blood cultures, and imaging to confirm the diagnosis. If caught early, antibiotics can reverse the damage. If not, the consequences are irreversible. The quiet symptoms that could shout the loudest. George recovered, but it took 2 weeks of hospitalization and rehab. Now every time he finishes a crossword, he says a quiet thank you for the neighbor who didn't wait and the ER team that acted fast. I almost waited myself out of existence, he later said. I didn't know a stiff neck could mean my brain was under attack. So now I ask you, have you ever had a fever or headache that seemed different and you weren't sure what to do? Or know someone who brushed off warning signs until it was nearly too late? Tell us in the comments. Sharing your experience could help someone else make the right call. If this gave you clarity, tap like to help it reach more families and caregivers. And if someone you love tends to ignore fevers or strange symptoms, share this video with them today. And don't forget subscribe to Golden Wise Elders, because we believe knowledge saves lives. And the more we know, the better we care for ourselves and for each other. When your body is fighting an infection like meningitis, the consequences are immediate and severe. But some of the most dangerous symptoms are those that don't involve pain at all. When your brain isn't getting the oxygen it needs, the signs are often subtle but irreversible. Slurred speech, a drooping face, or weakness on one side of your body. Let's dive into how these seemingly small symptoms might signal a major stroke and why immediate action is essential. 7. Slurred speech, facial drooping, or arm weakness. When your words stumble or your smile fades, your brain may be screaming for help. It can happen in the blink of an eye. It can happen in the one moment you're sipping coffee and chatting about the weather. The next your speech slurs, your hand trembles, you smile, and only half your face moves. It's easy to brush off, to think you're just tired or that you slept funny. But if there's one lesson this video must leave you with, it's this. When the brain is in trouble, it doesn't ask politely. It malfunctions, fast and without apology. Linda, 69, a retired elementary school principal from Georgia, was reading the morning paper when her coffee cup slipped from her right hand. Her husband laughed at first, joking she needed a refill. But when she tried to respond, her words came out garbled, nonsense sounds that shocked even herself. He saw it instantly. Her smile was uneven. Her right eye drooped. He remembered a video he'd seen about the FAST method. He called 911 without hesitation. That one call saved her brain and her independence. What's happening during a stroke? A stroke occurs when blood flow to part of the brain is interrupted, either due to a blockage, ischemic stroke, or bleeding, hemorrhagic stroke. Without oxygen, brain cells begin to die within minutes. And here's the terrifying part. According to the American Stroke Association, nearly 800,000 strokes occur each year in the U.S. Even older adults, especially those over 65, make up the vast majority of cases. But many don't recognize the symptoms in time to save themselves. A stroke doesn't always hurt, but it always harms. The FAST warning signs. You must know the acronym FAST is your best defense. F. Face. One side of the face droops when smiling. AA. Arms. One arm drifts down when both are raised. S. Speech. Slurred, garbled, or nonsensical words. T. Time. Call 911 immediately. Every second counts. Other warning signs include sudden numbness or weakness, especially on one side, sudden confusion or inability to speak, blurred or double vision, trouble walking, loss of balance, or dizziness, a sudden severe headache with no known cause. And in older adults, these symptoms may be subtle, easily dismissed as fatigue, dehydration, or just getting older. Why timing is everything. The most advanced stroke treatments, like clot-busting drugs or mechanical thrombectomy, must be given within hours of the first symptom. Miss that window, and the damage may be permanent. Dr. Stephen Katz, a neurologist at UCLA, warns, every minute during a stroke, the brain loses nearly 2 million neurons. Waiting is not neutral, it's catastrophic. That's why Linda was lucky. Her husband knew the signs. He acted, and today she walks, talks, and gardens like she always did. I didn't feel pain, Linda says. I felt strange, but not scared. If he hadn't acted, I'd be in a wheelchair. Or worse. Trust your instinct. Save a life. Don't hesitate. Don't second guess. Don't wait to see if it goes away. If your words feel tangled, if your smile falters, if your arms lose strength, call 911 immediately. It's better to be wrong and safe than right. And too late. Have you or a loved one ever had a stroke scare? What helped you act in time? Or what do you wish you'd known? Share your story in the comments. It might just change someone's life. Key warning signs of a stroke aren't always loud, but when they show up, they need immediate action. However, sometimes the symptoms are even more insidious, sneaking in unnoticed, like numbness or loss of sensation on one side of the body. A sudden dead feeling in your arm or leg may feel harmless, but it could be the precursor to a stroke. Let's take a closer look at why this subtle warning is one you should never ignore. 8. Numbness or loss of sensation on one side of the body. It comes quietly, just a strange tingling or a weak arm, and leaves just as fast. But if you wait, it might come back stronger and permanent. You're sitting in your kitchen flipping through mail when you suddenly notice something's not quite right. Your coffee cup slips a little. Your fingers feel fuzzy, detached, like they're not yours. You try to stand and your leg feels wrong, not painful, just weak, numb. 5 minutes later, it's all gone. You feel fine. You tell yourself, maybe I just sat funny. I'll keep an eye on it. But what you don't know is that you may have just experienced your brain's final warning, a warning that most people ignore. If your body goes silent for a few minutes, don't wait for it to speak louder. That's exactly what happened to Thomas, 66, from North Carolina. He was enjoying a quiet evening on his porch when his left arm suddenly felt like rubber. His leg buckled as he stood. He tried to call his wife but couldn't find the words. Then, just as fast as it came, it stopped. He laughed it off. I probably just got up too quick, he said, but 2 weeks later, he suffered a massive stroke that left him permanently paralyzed on one side and dependent on others for daily care. What is a mini stroke? TIA. And why it's so dangerous. Thomas had what doctors call a transient ischemic attack, or TIA. It's often referred to as a mini stroke, but don't let that word fool you. A TIA is no less serious. It's a temporary blockage of blood flow to the brain, and while symptoms may fade within minutes, the risk doesn't. In fact, research from Johns Hopkins Medicine shows that 1 in 5 strokes is preceded by a TIA, usually within just 48 hours. That means these small, strange moments are not isolated. They're invitations to act before the real damage begins. A TIA is like a fire drill in your brain. If you ignore it, the next time, it's not a drill. What symptoms should you take seriously? Even if they disappear quickly, these symptoms require immediate medical attention. Sudden numbness or tingling on one side of the body, inability to move an arm or leg, slurred or jumbled speech, loss of balance or coordination, vision problems, especially double vision or partial loss, a brief sense of confusion, blanking out, or not understanding others. Older adults may also experience subtle variations, brief dizziness, weakness that feels strange, or facial changes they can't see but others notice. Dr. Karen Fields, a stroke specialist at Stanford Health, warns, most people don't come in after a TIA because the symptoms go away. But by the time they come in with a full stroke, it's often too late to reverse the damage. What you must do, even if you feel fine. Don't assume it's just fatigue or posture. Don't wait to see if it happens again. Don't Google symptoms at home. Go to the emergency room immediately. Doctors can run a CT scan, MRI, or ultrasound to check for brain or artery blockages. Medications or minor surgery may be able to prevent a major stroke, but only if you act fast. When half your body goes numb, let that be the moment you choose to fight. Thomas later told his story at a senior center. I thought I was fine. I didn't want to be dramatic, but what I didn't realize was I had just been warned, and I didn't listen. Have you ever had a moment like that, when your body felt off, but you talked yourself out of going in? Or do you know someone who did? Share it in the comments below. You never know who needs your story to make the right decision. If you've stayed with us until now, thank you. That tells me something important about you. You care about your body, about your life, and probably about the people who love you and still need you here. We've just walked through 8 urgent warning signs your body might send, sometimes quietly, sometimes urgently, asking you to listen. You might have seen one of these signs before, maybe in a parent, a partner, a friend, or maybe in yourself. Maybe you brushed it off. Maybe you waited. Maybe you got lucky. But here's the truth. Our bodies don't whisper for no reason. And at our age, every signal matters. It's probably nothing is how tragedies often begin. But it's better to be safe is how lives get saved. So let this video be your line in the sand. From today forward, don't ignore a strange symptom. Don't wait until morning. Don't be afraid to make that call. Go to the ER or ask for help. Your health isn't just about you. It's about your children, your grandchildren, the people who still want to hear your stories, sit at your table, and learn from your life. You've spent decades taking care of others. Now it's time to protect yourself. With knowledge, with courage, and with the wisdom that only comes with age. Have you ever experienced one of these warning signs? Or watched someone ignore them until it was almost too late? Tell us in the comments below. Your story could be the very thing that saves someone else. If this video helped you, tap the like button. It lets YouTube know to share this with others who need it. And please, send this to someone you love. Someone who needs a gentle push to take their health seriously. And don't forget to subscribe to Golden Wise Elders. Here, we turn age into advantage and help you live smarter, stronger, and safer every single day. You've earned your years. Now let's make sure you enjoy every one of them. Healthy, present, and proud. Thank you for watching. We'll see you in the next video. Until then, take care of yourself, because you're not done making memories yet.